October marks Depression Awareness Month, and not only that, but today is also World Mental Health Day. In May of 2023, the U.S. Surgeon General called loneliness and isolation an epidemic, and that's why now, more than ever, mental health has become a growing topic. Here to talk more about World Mental Health Day is Dr. Krystin Holmes with the Harris Center. I'm so glad that you're able to come in studio and talk to me about this.
Yes, thank you so much for having me.
So let's actually start off with that loneliness being an epidemic. I mean, I think once the U.S. Surgeon General said it, then it was like a light bulb went off for a lot of us. We were like, yes, that's what people are experiencing. Why is that?
You know, I think it resonated with a lot of people because oftentimes people are feeling a certain way but afraid to say it. So I think when one of the things we do as therapists is say out loud what people are afraid to say to themselves. So when you say something like, you're experiencing loneliness and isolation, this sounds like depression, or it sounds like you may be experiencing this feeling, people go, yes, that's exactly how I'm feeling.
Yeah. And it clicked. And then, you know, since the pandemic, people have been a lot less afraid to talk about it, and
Sure.
It's been less of a taboo subject. I say that's the best thing that came out of the pandemic, right? So if somebody is struggling but they don't really know how to pinpoint it, like you said, you need to put the words out there and then it kind of clicks with them. What would be like some signs and symptoms of depression? What would they recognize as being a sign of depression?
Sure, if somebody is experiencing maybe an activity they used to find enjoyable and now they really don't. They're abstaining from events with friends or family. They find themselves just going to work and coming home, getting in a monotonous routine. Just things that low energy, trouble sleeping, difficulty concentrating.
I find the routine part to be kind of confusing, right? Because sometimes to manage depression, you have to stick to a routine, but then that routine becomes mundane and that can lead to depressive symptoms. Like, where do we blur the line here?
I think that key is in the isolation piece. So if you are going through your day-to-day routine and you interact with friends and family and coworkers, maybe you have a yoga class or an exercise group that you constantly work out with or regularly in a routine with, but then you notice, I still feel isolated.
Yeah.
I still feel down. Despite having these activities that should be good and helpful for me, I feel alone. That's when I think we start to notice, hey, maybe this is something to look into.
People sometimes hide their depression and sometimes convince themselves that, well, I'm good at doing things by myself, or I'm just an introvert and stuff. How can that be bad for their health, though?
The hidden depression piece, you know, we talk about high functioning depression, where I think so many of us just go through the motions of our day. We're just making it from event to event to event, and maybe we look at colleagues or friends or family and go, gosh, they just have it all together. And I feel like I'm just barely making it by. So that's one way in which we mask things, putting on the happy face, making jokes. You're the, you know, not the wallflower, you're the center of attention in events, but then you go home and just really feel very down about yourself.
Okay, those are symptoms. What would, how could loneliness and isolation then lead to depression? Because they are two different things here.
Sure, yeah. Feeling of isolation and loneliness is one thing, but a clinical symptom of depression is another. And so that's where we want to engage with experts. Go talk to your primary care provider, talk to a therapist. Go get connected with someone who can say, hey, I think this is a little more than just feeling alone or isolated. This is moving into that clinical depression space.
Is that what we should say? Because so many people were raised that, you know, mental health is a taboo subject, and I don't think they know how to just say, like, hey, I need help. So what should they say to their primary care provider about that would signal that they might need to see somebody or they need a referral to see somebody?
You know, a lot of people ask questionnaires these days. You can go in and fill something out. You can take a lot of questionnaires that are online. At the Harris Center, we have an app that people can download to get connected to help. And there are so many virtual resources. You can text a counselor. You can call 988 to get connected with resources at the local and state level.
What resources does the Harris Center have aside from the test that you just talked about?
So the Harris Center, we offer counseling support and services. We can get you connected with a licensed clinician. We have 24/7 crisis access, so you can connect with a counselor at any point in time. You can go online, you can walk into a service center, or you can call our crisis line.
I mean, we talk about calling 988 for suicide all the time, but a lot of people don't realize that also that crisis line goes to you guys. You're answering the call for that. So if you do make these calls, you're talking to somebody here locally locally. So
Correct.
somebody who might understand, and I know that that's really important after, say, a school shooting or Beryl or something that is regional to us, that maybe
Sure.
somebody here locally would understand a little bit better.
And I think people are hesitant to call a crisis line thinking, oh my gosh, this isn't really that serious, right? I don't need to call a
It's
crisis
not a life
line.
or death situation right now.
Right.
Yeah.
But I think it's important for people to understand all you're doing is getting connected to a licensed therapist, a clinician who can help you connect to further resources. So we're not sending anybody out to your home unless you just want us to. We have community case managers that go out into the community and meet people where they're at. And we always invite you into the Harris Center at any point in time.
I think that's great to know because a lot of people don't know where to start, and it can be as simple as calling the Harris Center, and you guys will help determine where to start.
Yes, absolutely.
Very good. Dr. Krystin Holmes, thank you for coming in and answering those questions here on World Mental Health Day. I think this is a really good topic.
Thank you.